Okay. So that being said, do you also work with alternative medicines, cases in that?
There are many, many people, especially the baby boomer generation,
Okay.
who are very into what's called CAM, which is various types of alternative medicines.
Yes.
And if people are interested in that, we just want to, again, know what they're doing, document it, and make sure that they're asking the same kinds of questions
Okay.
so that they're getting what they think they're getting,
Okay.
and that the any other providers that they're working with or talking to are also aware of what's going on, so that nobody is working in the dark and not realizing the effect
Okay.
that one thing can have on the other. A very important thing we talked about medication
Yes.
is supplements. A lot of
Okay.
people don't realize that the supplements that they have may have an impact on the medication and its effect on their body. So people have medication lists sometimes, and it's
Yes.
always a good idea if you ever need to go to the hospital emergency department to
Okay.
take the actual vials of medication with you. Don't take a list. Don't try to
Okay.
remember off the top of your head. Bring the actual
medication
bottles
and
in
the
the little
supplements.
bottle and the supplements, because even from manufacturer to manufacturer can make a difference
Change.
in the
Okay.
same supposed supplement
Okay.
strength and form, but it may not actually have the same interaction. It may come from a different synthesis, and it may have a different interaction. So it's important to bring that information to the doctor's attention so that
Okay.
they're paying mind to that when they make their decisions. We're not here to say doctors are doing anything inappropriate. We're just saying it's an overwhelming system. There are so many
Exactly.
people that you need somebody on your side advocating for you. We want to make sure that across the continuum of care, people are coordinating.
Yes.
People are not acting in a vacuum without recognizing what's happening with somebody else. So certainly, for instance, somebody has a diagnosis of a life-threatening cancer.
Yes.
There's going to be a lot of people involved in their care. There's going to be a whole team. And last month's Consumer Reports had a vision of what
Yes.
healthcare will look like in 50 years from now if you have a headache. And they suggest that the first person you're going to call is your healthcare advocate, because they'll be sort of the coach or the chairperson of the
Okay.
team to be able to reach out and contact the various people.
Okay.
But they also envision that you'll also be able to get access to your medical records easily, and that you'll be a participant and director of your own team. That's not the way it is now. The way it is now is the hospitals or the doctors, they own your medical records. You have to
Okay.
fight to actually get your own medical records. And they determine how long you're staying. They will tell you, you're being admitted, we're admitting you, we're not admitting you.
Yes.
Not what you want. They don't ask you what you want. And informed consent is usually a very thick binder placed on your belly as you're
Yes.
being wheeled on the gurney into surgery. Sign here.
When
Do
you
you
don't
have-
have time to
Do you
say
have,
to
you have no
read
time
or
to
process
exactly.
all that is because you're studying to get well.
That's a huge amount of information to process and incorporate. You only have time to ask questions or really get a good understanding. Is that truly informed consent, or is that just consent?